My name is Jessica Waterson, and I'm a senior lecturer in digital health at the Jeffrey Chase School of Medicine and Health Sciences. I'm also the Southeast Asia lead for NEED, which stands for the Network for Equity Through Digital Health. So to start off, I'll tell you a little bit about digital health at Monash University, Malaysia. So we define digital health as using a digital tool with the goal of improving health or well-being. You can probably tell that's a really broad definition, so there are a lot of different ways that we can apply digital health. For example, the kinds of digital tools that we use, they can be electronic medical records, they can be mobile apps on people's phones. We can also think about telemedicine or telehealth that allows people to access care remotely. Another tool we use is text messaging or SMS for communities that don't have smartphones. And we can think about virtual or augmented reality and how that technology could be used to improve health. So really any kind of digital technology that's out in the world that we can apply to health could fall into the category of digital health. Similarly, we can work on a broad range of health issues. You can work on chronic diseases like diabetes or epilepsy, infectious diseases like COVID-19 or tuberculosis. Digital health focuses on keeping people healthy through education or promoting the use of preventative services. And it also focuses on treating illness. You've probably heard of tools like digital therapeutics or digital devices that can actually help treat conditions. We also help to support healthcare providers through better record keeping and also through tools that help them with clinical decision making. So just to highlight some of the current and upcoming projects that are happening at Monash in Malaysia, this is just a small sample, but I'll give you a few examples. So one is a project that was started by Professor Umadevi Palanisamy, and she's working on an app to help the deaf community access video translation services so that they're able to attend health appointments and communicate with their healthcare providers. Another example is a mobile app that's being developed to promote immunization coverage among refugees in Malaysia. We also have a project on monitoring and predicting when someone with heart failure is having an exacerbation. And the system could then generate an alert to the provider to make sure that they get the care that they need. Another project is an automated device that helps to predict and prevent seizures. You probably heard Dr. Farouk mention this project earlier, and he's the one leading this one. And finally, we're working on securing funding for a project focused on delivering diabetes health education via WhatsApp, which is a tool that most people already have on their phones. And we're hoping we can leverage that to help people learn more about how to manage their diabetes. Finally, I just wanted to share what I believe the impact can be of digital health. So one area that digital health is really great for is improving access to healthcare and to health information. As many people know, smartphones are becoming ubiquitous. Even in rural communities, even in low-income communities, people still often have access to a smartphone. And so I like to think about how we can leverage this tool that's in everyone's hands to help make them healthier. We can also reduce the impact of diseases on people's daily lives. Like the example I shared about heart disease, for example. If we can help people to be able to stop worrying and only alert them and their healthcare providers when there's a problem, then they can focus their energy on their family or their work or things that are more important to them. We can also promote greater equity in health for the same reason I highlighted before. With more people having access to digital technologies, this means that rural communities or low-income communities can have better access to high-quality healthcare and health information. And finally, by leveraging tools that people have already in their lives, we can give people the power to take control of their own health. So I really hope that some of you will choose to come and pursue your graduate research degree with us here at Monash University, Malaysia. Thank you.